Having access to prescription glasses and eye care is something that a lot of us might take for granted, especially if you live south. But some say that more needs to be done to improve eye health care on some remote First Nation communities. So the Assembly of Manitoba Chiefs says it's time to come up with specific solutions to address the issue. This is Grand Chief Kyra Wilson speaking with CBC host Faith Fundal.
Welcome to the program. Hello.
Hello, thank you.
We'll talk about True North Health in a moment here. Without getting too much into the nitty-gritty, how long might it take for someone in a remote community to see an optometrist?
Well, of course, when we're looking at any healthcare service, obviously the wait times for a number of different services can be longer than anticipated. And so when we think about some of our remote or isolated communities, or even communities outside of urban areas, community members have to travel in to receive these services, which is an issue with accessibility.
So essentially, it's not hey, I want to see an optometrist or an optician. I can get it done in a day, maybe 2 or 3. It's I have to make some plans to be able to do this.
Yeah, and of course that costs money, and it's very expensive in terms of transportation costs and even accommodations. So if you're traveling into an urban area to receive any type of healthcare services, there's so much more planning that goes into it when you're traveling in from a First Nations community.
Right. You're talking about paying for vision care services. If someone isn't covered by the province, doesn't have health private insurance, does the next best thing, the non-insured health benefits program, or NIHB, does it cover the costs?
Well, it's supposed to be covering the costs, but in this instance, when we talk about optometry, there's certain restrictions and guidelines that First Nations Inuit Health Branch is dictating in terms of how First Nations are receiving care. And so over the years, what we've seen is that the inherent rights and treaty rights to health have dwindled significantly. And so when we talk about optometry in this instance, the decision is not being made by our leadership and by our communities. It's being made by government, which is not okay.
Right. And when I look at the healthcare for vision services grid, the first thing, which is the visit, is covered up to a maximum, but then everything else requires essentially pre-approval. We're talking about this because we have companies like True North Health trying to set up shop. What's your understanding of what it's trying to do?
So really right now, what I see a number of different providers, including True North, is they're wanting to bridge some of these gaps and some of these barriers that children and adults in First Nations communities, when it comes to access to any type of service regarding health. And so, when we talk about optometry, there were some I guess, information that was provided to us where there's probably roughly around 44% of children that needed prescription eyeglasses, but only 10% of their eyewear is being covered right now, which to me, that's an issue when we talk about our children and their education and their access to a basic right and a basic need.
A spokesperson for the program that manages the NIHB claims says in a statement that it does not have, quote, any outstanding or unprocessed eyewear claims from True North Health. What's your interpretation of that statement?
Well, I think that there's another part to that. It is what kind of requests are they denying? They may not have any outstanding requests because they're denying requests. So right now, what we are seeing is that children and families are wanting to receive, these benefits through NIHB, and they're being denied.
Grand Chief, what would it take, do you think, for companies to be able to provide optometrists, opticians, technicians to set up shop, providing vision care services, and also make good financial and business sense?
Well, when I think about the overall goal, it's to provide innovative solutions to bring healthcare services to First Nations communities. And whatever that looks like, we need to be supporting that because we have met with First Nations leadership and they have identified a solution to an issue that we're seeing, specifically to optometry. And what we're seeing is NIHB is denying this service that leadership is wanting to access. So they're providing solutions for their own nations, but they're being denied at the government level.
Could you give us an example, a specific example of what one solution might be that is continued to be denied by NIHB?
Well, right now, there are service providers that are wanting to go into community and they're wanting to provide teleoptometry. So being accessible to all the community members. And so right now, First Nations Inuit Health Branch, they're saying that teleoptometry is not being funded. This is not a service that they are willing to provide or pay for.
Is that an acceptable answer to you? I think I know the answer, but I'm going to ask anyway.
Yeah, no, it's not acceptable. Far too often, what we see is, First Nations Inuit Health Branch, NIHB. We provide solutions as First Nations, and they continually deny our requests and, the services and benefits that we've seen, even years ago have decreased. So, what they're doing is they're making unilateral changes without actually consulting our First Nations people and our leadership.
Grand Chief Kyra Wilson with the Assembly of Manitoba Chiefs. We will hear from True North Health still to come. Thank you for the time today and take care.
Thank you.
But right now, let's talk about some organizations that are still trying to come up with a fix. One of them is True North Health. That company's been working with First Nations communities to help bring clinics to them and make it easier for folks living in remote areas to see an optometrist regularly. Trey Westwood speaks for True North Health, and he joins us live in studio. Good morning. Thanks for being here.
Good morning, Marcy. Thank you very much for the invitation.
So we'll talk about teleoptometry in a moment, but how do you characterize how, eye care works in these communities right now and the lack of access?
Well, this is the general program that's in place for remote or faraway communities. Twice a year, an eye doctor will enter into a community for 4 days. In that, per day, they can see about 30 patients. So in each 4-day stint, they can see about 120 patients. So 240 patients total per year. So if you're up in a location like Norway House that has a population of 6,500 people, you're seeing a tiny percentage. You are serving a tiny percentage of the population in these communities. Right now, that is the way eye care is set up.
That must be really difficult for people. I mean, you're wearing glasses, so am I. So, your eye health changes. You might have emergency needs and such, and you have to fit everything into these windows of time.
We've met with Chief and Council several times that all of them right across the board said we never had our eyes checked as kids. So think about the kids in these communities. When you're talking about a tiny percentage of people being seen each year, and by the way, their right is to receive an eye exam every single year. It's so terribly underserved that it's something approaching criminal, basically. And there is a very easy solution that is cost-effective and revolutionary that we're able to deliver right now. And like Grand Chief said, it's being denied by the funding bodies.
So we'll get into how it works still in a moment. But I want to ask first, what communities are you helping right now?
We're currently in Ebb and Flow, Norway House, Sandy Bay. We are set to also begin our services for primary eye care in Garden Hill, St. Teresa Point, and a number of others right now that we're just on the cusp. Of course, when you're discussing a program this revolutionary for eye care for the communities, people were very warm. The communities were exceptionally warm and interested in what we were doing. So we are upwards of about 10 communities right now that we are either in or in the process of helping.
And how does it work when you come into a community then? Let's get into the logistics.
Yeah, so what we have a relationship with a manufacturer out of the States. We arrange for the equipment either to be driven in flown in, whatever is the easiest and best way for it to get into the communities. This remarkable state-of-the-art equipment, which is as good or better than eye doctors would have in Winnipeg right now. It fits into a space that's about 10 by 10 is all that we need to set it up.
Okay.
It's set up. And then we also train 2 to 6 members of each community as technicians. So there's a real beautiful connection to the community in that manner as well, where it provides employment and also plants the seeds of dreams of becoming involved in that field going forward.
And then to follow up as well, is there also a virtual component to go over results?
Yes. So the doctors are, in an appointment, there'll be the patient, there'll be the technician that we've trained for the community, and then the eye doctor will be in the appointment virtually.
Smart.
So very similar to telehealth.
Yep.
The exact same sort of a thing. And with the equipment that we have, all information is coming right in through to the doctor. They can see everything. All of the different photos taken of the eyes and all the information. So they get full understanding of what's happening in the process.
Vision care is generally covered. We heard Kyra Wilson's, the Grand Chief's concerns, but vision care is usually covered by First Nations and Inuit in Canada through the non-insured health benefits program. Mm-hmm. Obviously, we heard that it's not a covered benefit. How long have First Nations been fighting for this to change? Like as you said, Troy, your view of this is that it's criminal that it's not covered.
Well, the technology hasn't been there up until very recently to be able to deliver teleoptometry at the level that it is on par with in-person, like for anyone walking into an eye doctor to get. But now all the way across Canada, all the different provinces and the optometry associations allow teleoptometry. You can provide teleoptometry in Winnipeg. If we have a clinic in Winnipeg, a First Nation member can come to our teleoptometry location in Winnipeg and receive teleoptometry. That gets approved by NIB.
If it were covered, then how much might your business actually close the gap for eye care in these communities moving forward? Like, would you be able to get in faster to more communities if the coverage changed?
It's revolutionary. We've already tested given eye exams to all the kids in Ebb and Flow and Norway House, and you're talking about thousands of children there. When we did the testing, Marcy, 10% of the children were wearing glasses in the communities. When our eye exams, 44% of the kids need glasses in those communities.
What's the reaction from the kids you're working with?
Profound. Just imagine, and I could get emotional talking about this. And it's at this point, Marcy, it's a mix of anger and sadness. But imagine there was an 8-year-old kid, an elder in Ebb and Flow, who's the health director. Her granddaughter was refracted for the first time in her life. So this little munchkin had never seen, and she sits in and gets refracted. So that goes from not being able to see anything to being able to see. And the screams of joys from the kids is amazing. When you lock in and bam, now all of a sudden they can see. They might drop a swear word and that sort of thing, or just scream in joy.
Yeah.
And there's hugging, families hugging and things of that nature. So the impact is absolutely profound.
Because you're seeing each other for the first time maybe, and it would impact learning too. Because
imagine these spin-offs and all the things related to education, confidence, social circles, of the ramifications to having eyesight, of course, is massive.
So there's, in a statement, a spokesperson for the program that manages the NIHB wrote to us that, quote, they don't currently have any outstanding or unprocessed eyewear claims from the provider in question.
That's a lie. Are you serious? They said that.
That's the quote we have.
That's outrageous. We have hundreds of kids from Ebb and Flow and Norway House, the first 2 communities where we did eye exams for those beautiful children. There are hundreds upon hundreds of kids, Marcy, that are waiting for eye care. And NIB, FNIB, all the acronyms, ISC, they're all telling, no, we have a letter with them saying they will not cover or supply the glasses to the children in need because teleoptometry was used.
So if they say that the claims haven't been filed or denied, you're saying that
that's a lie.
It's a lie.
That's an absolute. I can't believe that they've said something like that. We have a letter from Indigenous Services Canada saying that they will not honor the funding to send the glasses. That's horrible.
If someone's listening this morning and they are on maybe a remote community or First Nation, can they outreach to your program, or how do you build the network?
Yeah, lots of calling and emails and communication, and of course the moccasin. And I'll just Anish Disna Kaska Case in the Chike down. My name is Troy Westwood or Little Hawk, and I'm the traditionally adopted son of Dave and Oriana Krishna of the Sagging First Nation. So the moccasin telegraph in the early days of me calling and reaching out to all the chiefs and members of council with this program, for sure. I've talked to most everybody in the province, but anybody interested can reach out to me at troy@truenorthhealth.co. But we are in communication with most everybody. I just rocked that, whether it was NIB, FNIB, or ISC, that they came out and said that there's no one that's not being taken care of, that the billing has occurred. Like that's just beyond pathetic and heinous.
Thank you, Troy, for being here this morning and telling us about your work.
Thank you very much, Marcy.
Troy Westwood is Director of Community Relations with True North Health. Now, CBC, just to reiterate here, did reach out to Indigenous Services Canada for comment on this, and it did say non-insured health benefits program provides eligible clients with coverage for a range of eligible benefits as outlined in the Guide to Vision Care Benefits, including eye examinations and corrective eyewear. ISC's Manitoba region for NIHB does not currently have any outstanding or unprocessed eyewear claims from the provider in question. They went on to say clients can contact their NIHB regional office for assistance in locating an enrolled vision care provider who can bill the program directly for eligible services. End quote.